Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing a every other week COVID-19 update. Today is September 9th, 2022. Boy, we have to be well into the 200s for the amount of updates we've done, but we're still going to continue to do them every other week. Our website is falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So as of yesterday, 5,373 PCR confirmed cases, positive cases. Those are PCR only. Again, if you haven't listened to me previously, the total number of cases that are occurring since much earlier in the year, I'd say sometime around in January, is skewed because most people are not getting a PCR. Most people are using home tests, which are not tracked. But in looking at it, we can compare PCR to PCR week to week over the last 6 months or so when the home kits are in, and we've been pretty stable pattern. I mean, there was 21 confirmed this past week, 40. Most of the summer was between 40 and 60 weekly PCR cases. Then there's some multiplier higher, 2, 4, maybe more home kits for each PCR. So, the case counts it's a pretty stable summer. I would say it's been stable everywhere. You'll see it when you look at MWRA, the Boston's wastewater. You can see the numbers are relatively stable. 9 probable cases since the 25th to the 8th. Our positivity is 13.4, and our positivity, 7.92, and our incidence rates is the number of daily cases if Falmouth had a population of 100,000. It was 13.4, so a little bit better. It was a little bit better this past week. Again, 21 PCR would mean, instead of 40 or 50, it would mean to me that there's also going to be less home kits. I think there's that whatever that multiplier is probably a relatively stable multiplier. So when PCR go up, PCR positives go up, then I would assume home tests would go up, and general infection rates would be higher. We are in the CDC green or low category. Normally what triggers us to go medium is the new COVID-19 admissions per 100,000. The number is 10. We usually hover between 9 and 10.5, and since we're below 10, we've always been plenty low on the percent of inpatient beds used with people with COVID-19, 2.8. The highest was like 3.5, I think. And our case rate per 100,000 population was 127.24, which is under the 200, so that allows us to get into the green category, if you see on the left. And since we're in the below 10 and below 10%, that gets us in the green. If you look, these are hospitalizations. It's been it's been a pretty stable summer. It's on a slightly down. All three are in a little bit of a downward pattern, but it was a pretty stable summer. The hospitals are not being, overburdened with COVID. State-wise, last time I did the presentation was a couple weeks ago. I think it was like 7,000 and change for cases. These are confirmed PCR for a weekly time frame. 6,000. So it's a little less than last week, so it's a little bit of a downward trend. I probably would assume that it will be when we start going indoors and it's dark at 4:15. That will eventually, see some case counts go up. We'll talk in a minute about the bivalent vaccine that may mitigate any of that, but we'll see. Positivity's been around 7, and we're in the 7s. This is for the state. Their trends, again, their hospitalizations are flat to maybe slightly up. The deaths have been down from pretty much since the Omicron wave that we had gotten, and so it's pretty stable to declining slightly numbers. MWRA, which is actually using your wastewater in the Boston sewer system, so to speak, the Metro Boston. They use they're detecting COVID, and you can see on the left, this is the southern system, and the north in green is the northern system. You can see it's been relatively stable, some ups and downs, slightly. It's more of an upward trend in the south, dip, and then a little bit of an upward trend, but relatively stable. You don't see these huge spikes. If you look in the far left, you can see we're just coming down from the Omicron when those numbers were way off the chart. That was the original Omicron. Again, looking at our peers, this is for the county, for Barnstable County. You can see that we're sort of in the middle for incidents. Right now, Barnstable, the town of Barnstable and Yarmouth are in the higher. Most of the other towns are either low or in the medium sort of range and mid-range. Same with positivity. We are in the middle, with some towns being higher and some towns being lower, sort of where we usually are with positivity and incidence rate. Again, that's all going to be based on PCR positives. So let's talk a little bit about boosters. The bivalent, or the one that includes the Omicron, is the new booster that's out there. And so that is trickling in. You know, I looked, Nurse Kathy and I looked today at VaxFinder. And when you go on VaxFinder and you go through it, there is some availability for it. And so everybody's transitioning over into the new booster. It's called bivalent because it's got the old and it's got some of the new, so it's got a couple of different makeups in it. And so your next booster should be, and you'd want the newest one, the bivalent one. And the third dose can be done 18 and older. You can get this right on the mass.gov or the CDC's website if you want more details. But the third is at least 2 months after the second dose or last booster. Over 18, it could be either Moderna or Pfizer. 12 to 17, you'd have to stick with Pfizer. So on the far right, got people 6 months through 4 years of age should get all their primary series done. 5 and older should get all primary series, and the booster dose is recommended for them by CDC if eligible. People's 5 to 11 are currently recommended to get the original monovalent booster. 12 and older recommended to receive the updated, what we call a bivalent booster. So there's a little bit of change, and you know, so that's, you can get this, you know, right. I just got this right from the CDC. If you just type in CDC's boosters, you can come right up to this, and I cut and pasted a couple of spots there. So your second booster should, you know, if you're eligible, you'd want the bivalent. There's so when you go in VaxFinder, you'll see pharmacies. You'll see there's plenty of open slots, but I think there's going to be like a muddy transition. I think they're going to want to get rid of their monovalent. Less people are going to want the monovalent, and so may see a little bit of a drop in appointment availability as they retool up with the bivalent. So there might be a little bit of a muddy period of the next couple of weeks, and then you'll start seeing it pick up, and then everything in all the pharmacies will be what you want. The homebound, you can always call the health department. If you know somebody who's homebound, we can take care of that through the VNA. They'll come right to the house. And again, children under 3, it might be difficult outside of your pediatrician's office. We found that during the summer when people are here not next to their pediatricians and they're here at their summer home. Community MD and the 4 Cs did have some, but under 3, vaccines are done in this country at pediatrician's office, so that hadn't really changed. As far as testing, again, home kits, the convenient MD and the pharmacy still do the testing, and Falmouth Hospital still does testing. So the takeaway on this is go on VaxFinder, and you might find an appointment for the bivalent to be a couple weeks away or so. There's just going to be a time frame at which they're going to need to restock the shelves, so to speak. So we do have a town-sponsored clinic coming up on the 14th of October. You can register if you go on our website. You go to the falmouthma.gov and click on the health department page. On the left, you'll see a column with a blue column with white lettering, and it'll say flu clinics and COVID clinics. Click on that. This is exactly what will come up, and then there'll be a live link at the bottom. It says clinic registration link. Clinic registration link, click here, and that'll take you to the registration for that clinic. We'll be doing flu. You can do flu and COVID at the same time, so we're going to be doing flu. There will be some high dose. I believe the senior center is also going to be doing a high dose clinic. But for us, it would be for the health department sponsored through the VNA. You'll be able to get both types of flu, and I'm assuming the boosters that are coming for this one will be the bivalent. I'm fairly sure of it, but you know, until we get it in our hands, it's sometimes hard for me to be 100%. But that's what the plan is. That'll be from on October 14th from 3 to 6 at the Gus Canty. Again, the quadrivalent single dose, and then you can get high dose if you meet the eligibility for seniors. And we are planning on having the newest bivalent as well. that don't preclude you to say, you know, well, I'm only going to want the town clinic. You know, if you want it earlier and you see it at CVS, by all means. I mean, I've had my boosters at CVS or Walgreens or whomever. So, you know, you can continue doing the Vax Finder if you really, really want that bivalent, and you can use this as a fallback, or you can register for this for now. So that's up to you. Vaccine-wise, 114 doses totally administered totally in this town between the 23rd of August and the 5th. I'm not surprised to see that to be relatively low. I think a lot of people are probably sitting on waiting on that bivalent. And if it's been 2 months since your last booster, you can get it. So this numbers will creep back up. The booster numbers will creep up once the bivalent becomes more widely available. What are we dealing with as far as it's pretty much all the BA5 with a little bit of BA4. BA4 really isn't gaining traction. It's all BA5. The bivalent should have both 4 and 5 in it. So I believe. So that's what we are. We're dealing with the BA5. And nothing, if you see, usually you see a wave. If you look at the far left, you see the pink being taken over by the new variant colored in red. Then you had the BA4, the BA4.6, and then the 5 just took over. But you don't see anything in the columns down in the lower right that show a new color coming in or a new variant. It's BA5 right now. So as a recap, our counts are pretty stable to, you know, a downward decline. And as we go inside and it gets dark at 4:15, not my favorite, you know, you'll start seeing more people indoors. Not going to be surprised if we start seeing an increase in cases, you know. But by then, there'll be plenty of vaccine around using the bivalent, and we'll see what happens. We're at the green low base right now. There's plenty of vaccine, although you may have to be a little bit patient with the bivalent. I'm not 100% sure how that's going to flow in and how quickly it'll flow in. And BA5 is a dominant strain. There are no mandates other than the town-owned properties as an advisory by the select board that's been in place for a while now. And again, there's no quarantine rules per CDC. Used to have to quarantine if you weren't fully vaxxed and boosted, but that has gone away. So you just it's on the website. You know, wear a mask for during the time frame. If you're a case, you're still out the 5 days minimum, and then you would mask through day 10. So nothing's changed on that. So again, we'll do this again in 2 weeks, and everybody take care. Thanks.